Good day to all of you. My name is Dr. Natalie Mundo, and the topic for today's lecture is all about craniomaxillofacial. The first objective is a little review on the anatomy of the skull, focusing more on the bony structures. The second objective is by the end of the lecture, you will be able to identify and enumerate the different sites of fractures in the head, especially the common ones. And the third is that you will be able to recognize the signs and symptoms of the different fractures in the face. This is the frontal and the lateral view of the skull. The skull is composed of many bones, namely your frontal bone, nasal bone, zygomatic bone, the maxillary bone, the mandible, the sphenoid bone, as well as the ethmoid. At the base of the skull, you will be able to see the palate, which is part of your maxillary bone. The zygomatic, this one is the arch, and then the sphenoid bone, where you could find the medial and then the lateral pterygoid here. For a better assessment of the facial area, we divide the face into three parts. The first is the upper third. The upper third of the face here is composed of your frontal sinus, the frontal recesses, the ethmoid air cells, the orbital roofs, the ethmoid roofs. That is your middle third or your mid-face. So this is composed of your zygomatic bone here, your maxillary bone, your temporal bone here, your frontal bone, your sphenoid in the inside, and as well as your pterygoid process. Your lower third, which is composed of your mandible. So, in the base of your skull, you could also see your pterygoid plates here. On the lateral part of your skull, you could also appreciate your pterygoid plates. So here, you could see the your maxillary bone, your zygomatic bone, which is cut, and below it you could see your sphenoid, this one, the yellow colored bone area, and then this one is your palatine bone, and you could see here in the middle your pterygopalatine fossa. So when your zygomatic bone is cut, you could see part of your maxillary bone. Here is your maxillary sinus, and this one is your pterygoid plates. So this is the CT scan, axial and coronal view, where you could appreciate the pterygoid plates inside the red box. So this is affected also when there is a mid-face fracture on your patient. So another part of your skull is your zygoma, which is composed of the following parts: your zygomatic co-maxillary suture or your malar eminence, your zygomatico-temporal suture, the zygomatico-frontal suture, and the fourth one is the zygomatico-sphenoid suture, which is inside your orbital cavity. And then the last one is your temporal root of the zygomatic arch. All of this will be maybe damaged when you have a tripod fracture, which will be discussed later. This is another view of your zygoma. It's a 3D recon CT scan where you could appreciate your zygomatic arch here, and here, the left side. So in the face, the bone is not just the important part, which you would have to assess during physical examination. So one of the important parts is the artery, the veins, and the nerves innervating the area. So this in the lateral view behind the zygomatic arch, you could find the maxillary nerve. So it is the second branch of the trigeminal nerve, which originates embryologically from the first pharyngeal arch. Its primary function is the sensory supply to the midface here. The next area is your inferior orbital foramen. So it is an opening in the maxillary bone located below your infraorbital rim here. So it transmits the infraorbital artery, vein, as well as your infraorbital nerve, which is a branch of your maxillary nerve. So these nerves provide sensory innervation to the skin and the mucous membranes around the middle of the face. This is mostly affected and likely be damaged when there is a midfacial fracture or a tripod fracture, which will be discussed later. So on CT scan, this is the coronal view and this is the sagittal view. As you could see here, as pointed by the red arrow, this is your inferior orbital rim and this one is your inferior orbital canal on the sagittal view. Another important structure is the orbit itself. Fractures involving the face could lead to detachment of your orbital muscles here, causing diplopia of the affected eye. So during the physical examination, it is also very important to assess not only the face but also the eye. Its light perception, the vision, and the range of motion. Another important area is the nasolacrimal duct canal. This is mostly affected on fractures involving the nasomaxillary area. The canal may be damaged or blocked during the injury, causing increase in lacrimation. So the canal, which runs through here going down to your nasal area, when you have fractures on the midface, this would be cut, causing blockage. So there would be an increased lacrimation here because your your tears cannot pass through the ducts. So this is the CT scan, and you could see here this is the canal. This is the right side as well as the left side. On eggshell and sagittal view, this is the nasolacrimal duct on your eggshell view, and this one is your duct on your sagittal view of the CT scan. Another area affected on midface fracture is also your hard palate, which could be detached during fractures. So here. So the next part will be your lower face, which is composed of your mandible. The parts of your mandible is composed of your condylar here, your subcondylar area, your coronoid, which is here, the ramus over here, the angle of the mandible, the body of the mandible, and the symphysis. This is the parasymphysis, in the middle is your symphysis. So next topic would be the buttresses. The buttresses is composed of your vertical and horizontal buttresses. These buttresses represents areas of relative increased bone thickness that supports the functional units of the face, so meaning the muscles, the eyes, the dental occlusion, and the airway. Um, these define the form of the face by projecting the overlying soft tissue envelope. As structural units that supports the face, the buttresses must either directly or indirectly interface with the skull base or cranium as a stable reference. These buttresses are very important to every ENT surgeon, especially in planning how to reconstruct a fractured area. So the first is the vertical buttresses. This is composed of first the medial maxillary, which you could see here. So this is the frontal view and this is the lateral view, from the frontal area down to the nasal area and going to the alveolar ridge of your teeth. That is the medial maxillary part of your vertical buttress. The next part, or the next, is the lateral maxillary vertical buttress. So this is from your frontal bone going down to your lateral orbit to the maxillary area down to your alveolar area at the sides. So lateral maxillary vertical. And the other one is your posterior maxillary buttress, here, located here. And next would be your posterior vertical. So you could see it here in the mandible area. Now, what are the parts of your horizontal buttresses? The first is your upper horizontal maxillary. So from your medial orbital rim going down to your inferior rim to the sides, going to your zygoma here. That is your upper horizontal maxillary. The next is your lower horizontal maxillary, which is seen here in your alveolar ridge of your maxillary area, so above your teeth. The next would be your transverse mandibular. So it is located in the alveolar ridge of the mandibular area, going to your ramus, the back, and also here in the chin area, you know, here.